A non-governmental organization, Civil Society in Malaria Control and Nutrition, ACOMIN, is calling on relevant stakeholders to support the AIDS, tuberculosis, and malaria eradication intervention projects of the organization to improve the wealth of the people. State Chairman of the organization, John Ihua Madwenyi, made the call while briefing newsmen in Port Harcourt. Nnamdi Olimini filed the report, which is read from our studios.
Mr. Madwenyi, who explained that 18 states in the country benefited from grant for the implementation of the program, said it covers 5 local government areas including Tai, Kana, Eleme and Obiabo. He said the aim of the grant is to support efforts at prevention and treatment of COVID-19 and preparation for future pandemics as to address inadequacies in the system through strategic interventions. According to him, the grant is geared towards priority intervention in areas such as gender-based violence prevention and post-care response to human rights and gender-related barriers to services, community-led monitoring and advocacy social mobilization, building community linkages and coordination.
The COVID-19 response mechanism grant seeks to address gaps in the systems and infrastructures by efficient and effective outcomes. The health systems as well as the communities and CSOs are integrated into the COVID-19 response such that all contribute their quotas in achieving results.
He said the grant would make changes by strengthening the health system in the country through targeted interventions that support federal government to adopt policies and strategies and review progress and ensure sustainability of AIDS, tuberculosis and malaria intervention projects.
Each component will contribute to making foundational changes by strengthening the health systems in Nigeria through targeted interventions that support the federal government to set up policies, strategies and standards as well as plan, monitor and review progress against those standards.
State Focal Person TB Network River State, Messiah Musan, and State ATM Network coordinators in their goodwill messages appealed to governments at all levels to support the project to ensure its success in their various localities. They also appealed to the media to partner them to propagate the interventions as they move to attract support and funding for the AIDS, tuberculosis and malaria intervention projects.
This has to do with the life of the rivers people, and if you're not alive, you can't enjoy the programs of government. So government at all levels should give their support to this project so that at the end of the day, the reason for which the grants was given will be achieved in the states.
The communities who the health facility are domiciled in their locations are passionate and are also willing to hold this project.
We want to also include the civilians working there. You are doing your best, you are trying all you need to do, but the more is also needed for us to achieve the end of this project.